how do you respond to those critics who say that if Medicare for All were implemented, that many of the best doctors would desert that system and would not make their services available through it?
That's a very unreasonable claim. If you look at countries like Canada, for instance, that have a single-payer system, essentially all of the doctors, all of the hospitals are in-network. If anything, in fact, a Medicare for All system will increase people's access to physicians and doctors. There won't be insurance networks that keep people separated, that keep people siloed, that cause disruptions in care every time your boss changes the insurance options you have, or every time you change jobs. Under a Medicare for All system, there will be one big network with all doctors and all hospitals included, essentially. So it's really not a valid claim.
President Trump said he's having his doctors and health executives in the Senate write legislation to replace the Affordable Care Act, like Rand Paul, who's a doctor, as well as Dr. Barroso, a senator, as well as Rick Scott, the now senator from Florida, who Democrats say oversaw the largest Medicaid fraud Medicare fraud in U.S. history. He was formerly the CEO of Columbia HCA when the hospital company was fined $1.7 billion for Medicare fraud. So if you could respond to that, but also explain what exactly Medicare for All would look like when it comes to getting rid of the health insurance companies, for example.
So, I mean, to respond to the first question, I think we should be extremely skeptical that whatever they generate is going to be any better than the really vicious piece of legislation that was proposed during the Affordable Care Act effort back in 2017. As we know, those bills would have slashed spending on public health care programs like Medicaid, would have slashed funding for the subsidies that make health insurance more affordable for some people. So I'm very skeptical that whatever they generate is going to be an iota more friendly than the last bit of, again, vicious proposed legislation.
Can you respond to Rick Scott, the former healthcare executive who's now in the Senate? This is what he had to say.
We do know that Medicare for All, which Senator Sanders is all in on, is going to just ruin our healthcare system.
So it's going to ruin Medicare, just to clarify,
and it's also going to ruin private insurance.
Did you just say that you expect the White House to come forward with the proposal first?
Well, I know in the end the White House is going to have their plan, and I know it's going to be difficult with Nancy Pelosi, but what I'm going to focus on is how do you drive down costs. The Democrats constantly focus on access. The problem is the cost of health care is too high in this country.
So he was speaking on CBS's Face the Nation. Dr. Gaffney, if you could respond to what he's saying, Democrats focus on access, I focus on cost.
Well, we know that countries that actually have universal access also have higher costs. These two things go hand in hand. The United States has terrible access and also has overall costs that are about double those of other high-income nations. The notion that there's a trade-off is simply false, and that's made clear as soon as you look across the national borders. We can, in fact, we need to achieve universal coverage, but that will also allow us to control costs moving forward.
And how would those costs be controlled moving forward?
So a universal healthcare system like single payer gives you unique ways of controlling costs. So, for instance, in the House bill that was put forward by lead sponsor Pramila Jayapal recently, that bill would basically create a universal healthcare system in which one plan covered everyone. And what we know about those sorts of plans is that they are far more efficient in terms of administrative overhead. To give you just a couple of numbers, traditional Medicare, the traditional Medicare program has a 2% overhead, meaning 2 cents of every dollar go to overhead, 98 cents goes to healthcare. For private health insurance companies, if you include profits, the overhead is over 10%. That's an enormous amount of money when you're talking about trillions of dollars of healthcare spending. That's just one way in which a public healthcare system is far more efficient than a privatized, fragmented system like we have now.